Lassa fever. Lassa fever, also known as Lassa hemorrhagic fever, is a type of viral hemorrhagic fever caused by the Lassa virus. Many of the patients do not develop the symptoms. When symptoms occur, they include fever, weakness, headache, vomiting, and muscle pains. Less commonly, there may be bleeding from the mouth or the gastrointestinal tract. The risk of death once infected is about 1%, and frequently this death occurs within 2 weeks of onset of symptoms. About a quarter of people, means out of 100, 25% may have hearing loss. They will become deaf, hearing loss. And this hearing loss is temporary. It will improve within 3 months in about half of these cases. Now let us see how this virus looks. Lassa virus is a member of Arenaviridae, which is a family of negative sense single-stranded RNA viruses. Specifically, it is an old world arenavirus, which is enveloped, means there is a cover is there. It is single-stranded and bisegmented RNA. The virus has both large and a small genome section with 4 lineages. 4 lineages have been identified. They are Josia, identified in Sierra Leone, GA391 in Nigeria, and LP Nigeria, and strain AV. This is the electron micrograph of a member of Lassa virus. This is a transmission electron microscopic picture of the Lassa virus. Now let us see the geography, where it has affected, which places. The countries reporting spread of disease are shown in the blue. Countries reporting a few cases are shown in green, and countries with unknown status are shown as grey. There are almost 3 lakh to 5 lakh cases, which result in 5,000 deaths a year. One estimate places in the number as high as 3 million cases per year. Now the geography of Lassa fever. Lassa high-risk areas are near the western and eastern extremes of West Africa. The Lassa belt include Guinea, Nigeria, Sierra Leone, Liberia. Guinea, Nigeria, Sierra Leone, Liberia, as shown in the map. The case fatality rate for those who are hospitalized for the disease is about 15 to 20%. 15 to 20%. Research showed a twofold increase in risk of infection for those living in close proximity to someone with the infection symptoms. The high-risk areas cannot be well defined by any known biogeographical or environmental breaks, except for the multi-mammat rat, particularly Guinea, Liberia, Nigeria, and Sierra Leone. It is less common in Central African Republic, Mali, Senegal, and other nearby countries. As of the 20 to 30 cases have been described in Europe as being caused. Now how it is spread. Lassa virus commonly spreads to humans from other animals, specifically the natal multi-mammat mouse or the African rat, also called the natal multi-mammat rat or Mastomyces natalensis. This is probably the most common mouse in equatorial Africa. It is common in human households and is eaten as a delicacy. They eat there in some areas. The multi-mammat mouse can quickly produce a large number of offspring and tend to colonize human settlements, increasing the risk of rodent-human contact. And it is found throughout the west, central, and eastern parts of African country. Once the mouse has become a carrier, it will excrete the virus throughout the rest of its lifetime through feces, urine, creating ample opportunity for exposure. The virus is probably transmitted by contact with feces or urine of animals accessing grain stores in residence. Individuals who are at high risk of contracting the infection are those who live in rural areas where mastomes are discovered, where sanitation is not prevalent. Infection typically occurs by direct or indirect exposure to animal excrement through respiratory or gastrointestinal tract. Inhalation of tiny particles of infectious particle is believed the most significant means of exposure. It is possible to acquire the infection through broken skin or mucous membrane that are directly exposed to the infectious particle. Transmission from person to person has been established, presenting a disease risk for healthcare workers also. The virus is present in urine between 3 to 9 weeks after infection, and it can be transmitted in semen up to 3 months after becoming infected. Now, how to prevent? This is very important. Prevention. This control, we have to control this mastomes rodent population which is impractical because it breeds like anything. So measures focus on keeping rodents out of home. Keep the rodents out of home and food supplies. Encouraging effective personal hygiene in the form of washing your hands regularly, storing foods in container with lids, keeping home clean and tidy, disposal of garbage from home, handle rats with gloves and other appropriate protective clothing, avoid contact with infected Lassa patients and deaths. Now, foodstuff, it should be in a rodent-proof container, and disposing of garbage from home to help sustain clean households. Gloves, masks, laboratory coats, and goggles are advised while in contact with infected person to avoid contact with blood and body fluids. These issues in many countries are monitored by Department of the Public Health. In less developed countries, these types of organizations may not have necessary means to effectively control outbreaks. Now coming to the diagnosis. Diagnosis. How do you diagnose Lassa fever? A range of laboratory investigations are performed where possible to diagnose the disease and assess its course and complications. The confidence of diagnosis can be compromised if laboratory tests are not available. One compromising factor is the number of febrile illnesses present in Africa, such as malaria or typhoid fever, that could potentially exhibit similar symptoms, particularly for non-specific manifestation. In cases with abdominal pain in countries where Lassa is common, Lassa fever is often misdiagnosed as you misdiagnose Lassa fever with appendicitis and intussusception, which delays the treatment with the antiviral ribavirin. In West Africa, where Lassa is most common, it is difficult to diagnose due to absence of proper equipment to perform testing. So the different tests that may become available include cell culture, PCR, ELISA antigen assay, plaque neutralization assay, immunofluorescent assays. However, immunofluorescent assays provide less definitive proof of Lassa infection. An ELISA test for antigen and IgM antibodies gives 88% sensitivity and 90% specificity for the presence of infection. Other laboratory findings in Lassa fever include lymphocytopenia, means low white blood cell count, thrombocytopenia, low platelets, elevated aspartate transaminase levels in the blood. Lassa fever virus can also be found in the cerebrospinal fluid. Now coming to the signs and symptoms. The onset of symptoms is typically 7 to 21 days after exposure. Once you get exposed to the virus, it takes about 7 to 21 days. 80% of those infected, they are asymptomatic. These mild symptoms may be present, including fever, tiredness, and weakness, headache. In 20% of cases, more severe symptoms such as bleeding gums, breathing problems, vomiting, chest pain, or dangerously low blood pressure may occur. Long-term complications, as I have told you, it includes hearing loss. In those who are pregnant, abortion or miscarriage may occur in 95%. 95% miscarriage can occur. Lassa fever can be difficult to distinguish clinically from other viral hemorrhagical fever such as Ebola virus disease. A combination of pharyngitis, pain behind the sternum, presence of excess protein in urine. So when there is pharyngitis, pain behind the sternum, presence of excess protein in urine and fever can indicate Lassa fever with higher specificity. In cases in which death occurs, typically this death occurs within 2 weeks, that is 14 days. About 1% of all Lassa fever infections result in death. Approximately 15% of those who require hospitalization usually die. The risk of death is greater in those who are pregnant. A swollen baby syndrome may occur in newborns. Swollen baby syndrome, you can see in the figure. Swollen baby syndrome may occur in newborn, infant and toddler with pitting edema, abdominal distension and bleeding. Now what to do when there is an infection in pregnancy? When Lassa fever infects the pregnant woman late in the third trimester, you should induce the delivery because it is very necessary for the mother to have good chance of survival. Because the virus has an affinity for the placenta and other highly vascular tissues. The fetus has only 1 in 10 chances of survival no matter what course of action is taken. You will have the fetal loss. Hence the focus is always on saving the life of mother. Always remember you have to save the life of the mother. Following delivery, women should receive the same treatment as other. Now how do you treat Lassa fever? The antiviral medication ribavirin has been recommended, but evidence to support its support is very weak. Some evidence has found that it may worsen outcome also sometimes as other antivirals. So symptomatic treatment in the form of fluid replacement, blood transfusion, and low blood pressure is there, so give medication for low blood pressure. Then intravenous interferon may also be used.